Let's talk about irritable bowel syndrome. Irritable bowel syndrome, you have, this is diagnosis of exclusion. What does that mean? I mean, you're going to check for every single thing, and every single thing is normal. Then you can say, okay, this patient has irritable bowel syndrome, because you check for every single thing, every single cause of constipation, diarrhea, or diarrhea constipation altogether. So you ruled out everything. Nothing came up positive. Now we can call it irritable bowel syndrome. But some features are there. What features? You have recurrent abdominal pain associated with two of the following. The patient has abdominal pain, which is improved with defecation. The pain is related to defecation. When he defecates, either the pain goes away, most likely, or either the pain increases, but most likely the pain decreases. It is this pain again is less at night, and it is also relieved by change in bowel habits. Change in bowel habits, for example, from diarrhea to constipation. It changes. The pain decreases. So the first thing is related to defecation. Second thing is the change in the stool frequency, which is again diarrhea, constipation. Third thing is the change in the form, consistency of the stool. Stool frequency is like how many times you use in the bathroom. Change in form is the diarrhea, constipation. But basically, in all togetherness, what you are going to be looking at, pain that decreases or increases with defecation, pain that is less at night, pain that is relieved with the change in bowel habits, and not associated with any food or anything like that. Okay. And with this pain for 3 days per month for the last 3 months. 3 days per month for the last 3 months. 3 days per month for the last 3 months. He is having this sort of issues, and the patient has this. You can call it irritable bowel syndrome, but after checking everything else. Okay, you have no structural abnormalities. Most common in the middle-aged females. Chronic symptoms may be diarrhea. Either you have the diarrhea predominant, meaning you have diarrhea, or the constipation predominant, you have constipation, or you're mixed. You have in the morning you have diarrhea, in the night you have constipation, or it's opposite. It just shifts. Diarrhea, constipation. Pathophysiology is multifocals or multifaceted. Okay. May be associated with fibromyalgias, mood disorders. So fibromyalgia, mood disorder, like anxiety, depression, stress, it can be associated with irritable bowel syndrome, IBS. The other one was IBD, irritable bowel disease. This is irritable bowel syndrome. Okay, the first line treatment is the lifestyle modification and dietary changes. What sort of dietary changes you want to do? Well, what do you want to do? You want to increase the fiber in diet. Okay, that's the thing that you want to do. Second thing, as far as the drugs go, you can give antispasmodics like hyoscyamine. Okay, hyoscyamine, that's the antispasmodics. So there is a decreased motility. Or you can also give, looking at, the history and all that. You can also give, to relieve these symptoms, you can give TCAs like amitriptyline, or SSRIs. Okay, so this is the treatment. But if a lot of people don't go towards that because a lot of adverse effects, so most likely it fixes with the diet changes or just give the antispasmodics.